Hello, my name is Alexis Merchant, and this is my presentation on ADHD. The percentage of children aged 3 to 17 years old in the United States diagnosed with autism is roughly around 9.8%, which is about 6 million. Some of the key features include difficulty maintaining attention, attention in conversation and easily distracted, which is categorized as inattention. Hyperactivity, which can include constant fidgeting, excessive talking, and impulsivity, which includes interrupting in conversation, engaging in risky behaviors with absence of prior consideration. Part of the history of ADHD, the first observations may have been as early as the 1800s, though it was not recognized as a disorder at that time. In the 1950s, some stimulants were implemented to try and sedate the effects of ADHD. However, it had not been put into the DSM yet. And then in the 80s, they added attention deficit disorder to the DSM-2 without attending to the hyperactivity aspect of that. And then in the 2000s, ADHD was recognized in the DSM as a disorder. Some of the criteria for ADHD include often fails to give close attention to details or makes careless mistakes in schoolwork, at work, or during activities. Some examples of that would be overlooked or missed details and your work is inaccurate. Often unable to play or engage in leisure activities quietly. Often has difficulty waiting his or her turn. An example of that would be waiting in line at school. That's some of the DSM-5 criteria to categorize ADHD. And these symptoms must have been present for at least 6 months, with several being present before the age of 12, inattention, hyperactivity, and impulsivity, as we already discussed. Some of the criteria for autism, which closely aligns with some of the criteria for ADHD, they don't respond to their name, they don't maintain eye contact, and they imitate. In individuals with ADHD, the prefrontal cortex is affected, especially in the right hemisphere, contributing to difficulty in executive functioning and decision-making. And individuals with ADHD also have an affected limbic system, leading to greater potential for difficulty regulating emotions, moodiness, and irritability. Additionally, people with ADHD have dopamine levels that are significantly lower than neurotypical people. This lower dopamine contributes to hyperfixation tendencies, which is where they will obsess over something and spend hours, weeks, months focused on that thing. People with ADHD also have significantly lower levels of norepinephrine, contributing to things like sleep problems, anxiety, and elevated stress. One route of treatment for ADHD is stimulants. Stimulant medication helps essentially quiet the symptoms of ADHD, such as difficulty focusing. These are often the first line of treatment, though they do come with risks of somatic, cognitive, and emotional side effects, such as stomach aches, diarrhea, depression, things like that. An additional form of treatment, often provided in combination with stimulant medications, is cognitive behavioral therapy, where certain behaviors are rewarded when necessary or modified when necessary. This is to help manage the symptoms of ADHD. In neurofeedback, brainwaves are recorded during a particularly stimulating activity, though the effectiveness of this method of intervention are questionable and the findings are mixed. When dealing with ADHD in real-life settings, such as classrooms and at home, perhaps challenging one's own view of ADHD could reduce societal stigma surrounding this disorder. According to Stephen Tonti, our view of ADHD as a difference in cognition rather than a disorder may help reduce the stigmas around having ADHD. Tonti contends that people with ADHD do not necessarily lack the ability to pay attention, rather the difficulty lies in where they place their attention, as they may have difficulty determining where to focus it. According to Tonti's talk, I believe that it is essential for educators to be trained on how to teach kids with ADHD. Perhaps this could look like more colorful learning activities to help capture and maintain children's attention, or more interactive styles of classrooms for children with ADHD so that they are further encouraged to stay engaged with class content. These are my references. And yeah, that's all. Thank you.